I thank the organizers for giving me this opportunity. So this talk will be about the FDA approved orthobiologics. It is the Indian FDA or the Indian DCGI approved orthobiologics. Many people still don't realize that stem cell therapy is approved in India. They still think it is in a form of research, but it is already clinically approved. And when we say that is the about orthobiologics, it is actually the regenerative medicine products which are derived from body's own cells as well as the growth factors which can reverse and regenerate multiple pathologies. Mostly we do it for the musculoskeletal pathologies, but it is also applicable to all tissues in the body, and it can be done either alone or in combination with surgical procedures. So going straight to the products, so India is the only country in the world which has got so many products which are approved, particularly in stem cell therapy, mesenchymal stem cells. There are 7 approved products, and the first approval started in 2014. So the ophthalmologists were the first to use the limbal stem cells. So the limbal stem cells were available since 2014, autologous. Patients' own cornea, they took the limbal stem cells and applied it for corneal blindness through the company called Reliance Life Sciences. So this was available since 2014. Similarly, now the allogenic bone marrow derived stem cells are approved for Buerger's disease, though it is available since 2021. It was approved in 2017, and since then the diabetic ulcers, non-healing ulcers, osteoarthritis, and other indications like for skin regeneration, hair regeneration, and under eye dark circles, the conditioned medium derived from allogenic bone marrow stem cells are available in the market. So apart from that, there are a couple of gene therapy products as well as the immune products, but our focus is on the stem cell products, mesenchymal stem cells. So this is another company, Regrow Biosciences, which has got 3 products: Osgrow, Cartigrow, Urigrow. Osgrow is for bone, where you take a biopsy of the bone, send it to the company, they will culture it and send it back to you within 3 weeks, around 50 million cells. Similarly, for the cartilage, in cartilage regeneration, and for the mucosal regeneration of the urethra, less than 4 centimeters strictures, you can take the biopsy from the mouth, from the buccal mucosa, send it to them, and they will culture and give it back within 3 weeks, which can be injected for stricture urethra. So these are some of the products which are available not only in orthopedics but also in other specialties. So this is the approval letter. You can see the date of approval: 2017, 2020, 2022 for the TAO, CLIPAD, and osteoarthritis. So now any orthopedic surgeon in India can prescribe these stem cells, get it in their clinic, and use it for their patients for a particular indication. Worldwide also there are other stem cell therapies which are approved in Japan for Crohn's disease, GVHD, and for the first time for Parkinsonism, a neurological disease. They have got approval, 5 doses, intravenous and intrathecal, and the approval came in 2023. Europe and South Korea also have got 2 products, but it is India which has got 7 products. So this is the product for osteoarthritis called Stem1. So this vial contains 25 million allogenic bone marrow derived mesenchymal stem cells. So the company has done all the animal trial as well as the human trial, and then come out with a product after phase 3 trial for grade 2 and grade 3 osteoarthritis. And there is at least 1 year pain and stiffness reduction, and the cartilage quality is maintained. Volume is maintained for 1 year, whereas in untreated there is a decrease in cartilage volume with minimal side effects, and the 2-year data is also awaited. But we have been using it for autologous for our patients for more than 10 years. So this product Stem1 is obtained from 3 people, from 3 young adults, taken from the bone marrow, and you can make it into 1 million doses, and it can be used for osteoarthritis, which already the approval has come, and other indications. These are pending. Next year probably we will get these approvals. So osteoarthritis, as I said, we have been doing autologous. So this is our very early case, where you can see we used autologous patients' own bone marrow concentrate and injected, and within 7 months you can see an increase in the cartilage height, and that is possible only in age group of 55 to 60 years. So another case you can see another 54 years old female where the cartilage not only increase in the cartilage volume but also the quality of the subchondral bone as well as the articular margin. Osteophytes disappear as well as the articular margin becomes clear. So how long the effect lasts? So you can see that if the patient reduces the body weight, if the patient is doing all the exercises properly, not putting on more weight, you can see up to 48 months, up to 4 years, the cartilage, initially there's an increase in the cartilage volume, and as the patient walks for the next 4 years, again comes back to the same stage. So for 4 to 5 years, you can have a sustained relief of pain, and probably after 4 years, 5 years, we may have to do a booster dose. And still many people don't realize that cartilage can be regenerated and there can be an increase in the cartilage volume, which is shown by MRI. This is from another group which has done adipose derived stem cells, and they have demonstrated the increase in the cartilage thickness in an MRI. It's not only the thickness, you can also see here also there is an increase in the cartilage thickness, but it's not only the thickness, but it is also the quality of either the cartilage or the cruciate ligament or the meniscus, whichever is injured inside the knee joint. So here is a histogram. So this in MRI you have gotten artificial intelligence software which can show that the increase in the quality of the cartilage by comparing the injured one and the healed one. If there is a shift to the left, then the quality of the soft tissue is much better. Here also you can see a partial injury healing well, and then there is a shift to the left, and this shows that the collagen quality has improved and the healing is better, scarring is much less. So this is again for a meniscus where they have with autologous PRP, they have shown pre and post injection the meniscus has healed within 6 months. So the orthobiologics, whether it is the platelet rich plasma or the bone marrow derived stem cells or fat derived stem cells, in some cases they are able to regenerate the musculoskeletal tissues like bone, muscle, tendon, cartilage, and that is why orthopedicians, dermatologists, sports physicians, and plastic surgeon diabetologists, they are avoiding amputation. They are recreating the collagen, this collateral circulation in cases of diabetic ulcer. Similarly, gynecologists for infertility and ophthalmology. So these are the people who have already started using orthobiologics. So thank you. So with the help of the other specialists also, we will be making more strides and bringing this revolution of regenerative medicine applicable to all of our patients, irrespective of their specialties. Thank you.